you so much, everyone, for coming today, and welcome to our COVID-19 update. My name's Lizzie, and I work at the Asian Resource Centre of Croydon, and I work on the Expert Patients Programme, the Long-Term Conditions Programme, Mental Health, and the COVID Engagement Programme. This event today is a joint event, so it's hosted by the Asian Resource Centre of Croydon with the Croydon BME Forum, with the Croydon Voluntary Action and the Croydon Neighbourhood Care Association. And we've done this in partnership with the NHS Croydon and Croydon Council. So just to make you aware, unfortunately, I do have to do a little bit of housekeeping. So the first thing is to let you know that this meeting is being recorded, and that's just so that we can upload it to our online platforms and give other people an opportunity to learn about the information. So if you're uncomfortable with being recorded, simply just turn off your video, and that's absolutely no problem at all. We do mute everyone as they come into the meeting, and you can appreciate that with this number of people, it's just not possible to conduct the meeting if everyone's mic is on at the same time. And please feel free to post questions via the chat facility. And you will also have the opportunity to ask your questions later yourself to our experts. And finally, just please do not post any links or images on the chat facility, or you may be removed from the meeting. And that's just because we have to take everyone's safety into consideration. So Mamun, can you just share the slide with everyone's socials on it? So as I said, this is a joint event with CVA, CNCA, BME and ARCC. And we do just want to encourage you that if you do ever need to know any more COVID information, vaccination information, or general sort of wellbeing, health, community information, then please do check out all of our websites. And we are active on things like Twitter, Facebook, Instagram, and YouTube. And YouTube is where we will post the recording of this video probably by next week. So please, please do feel free to follow us on those platforms. So housekeeping done, hooray! So basically I'm going to introduce the event with a message from the NHS. So if you can just share the poster as well for me, Maman, that would be fantastic. So the NHS just want to let you all know that people who are currently eligible to access the COVID-19 vaccination currently have sort of two additional options. So one is you can call 119, which is the national booking line, or you can call your registered GP to make an appointment to get the vaccine at a primary care site, a mass vaccination site, or at a pharmacy hub. And then we are really lucky that in Croydon, we do have one-off event walk-in appointments. And so we're really pleased to say that thanks to the Croydon Mosque and Islamic Centre and the AT Medic GPs from Thornton Road Surgery, the NHS is running a coronavirus vaccine clinic between 1:15 p.m. and 4 p.m. this Saturday. So that's this Saturday, the 20th of March. And it's for anyone who's currently eligible for the vaccine. So it's open for anyone aged over 50 or in an at-risk group over the age of 16 who have not already been vaccinated. And this one's really been set up to encourage local eligible people to get vaccinated in a location that's a bit more convenient and familiar to many in our community. And just to be clear, it is available for people of all faiths or no faiths at all. And at the moment, the vaccine generally is being offered to anyone aged 50 and over, people aged 16 and over who are clinically vulnerable, health and care staff, and unpaid carers. And this clinic on Saturday is a walk-in, so there's no appointment necessary. You just have to be from one of those eligible groups and basically just turn up. If you are not sure that you are one of the people in the eligible groups, then you can check the NHS website, which is just www.nhs.uk. So hopefully that all makes sense. So we're going to start with two polls basically. So can you share poll one, Mamun? And I'm going to pass over to my amazing colleague, Melissa. She's basically working on the EPP project with me, but for the Croydon BME Forum.
Thank you, Lizzie, and good afternoon, everyone. So we're going to ask you two poll questions just to find out your thoughts about the vaccination. And then at the end of this session, we're also going to ask you the same questions just to see if this session has changed your thoughts in any way. So Mamoon is going to share the first poll question up with you. So that should come up shortly. Okay. So as you can see, that's on your screen now. So if you could all just take a few minutes just to answer the question, which is, would you be comfortable to take the COVID-19 vaccination booster annually? So yes, no, or not sure. Okay, we're getting lots of answers in, so thank you. And just to remind you all that this poll is anonymous, so we won't see who's answered what. It's just for us to find out, just to get a feel for what everyone's thinking and feeling today. So just a few more moments to answer the question. Okay. Thank you. I think that's enough time. Is that okay? Should we end it now? Okay, perfect. Okay, so out of everyone today, 55% of you have said that you would feel comfortable to take the booster annually. 19% said no, and then 14% said not sure. So we will ask the same question, as I said, a little bit later, just to see if your thoughts have changed from the information you've received. Okay, so we're going to ask the second poll question. So we'll put that up on the screen for you. And thank you everyone for sharing. So the next question is, how informed do you currently feel about the COVID-19 vaccinations? So the answers are very informed, somewhat informed, a little informed, not very informed, and completely uninformed. Again, this is anonymous. Thank you all. So we can see a few more people are just voting, so we'll just wait a little bit longer for everyone else to respond. Thank you. Okay. Thank you. I think that's enough time now. We'll end it there, and then we'll just get the poll results up. Okay, so we've had, so the response from that, 45% of you have said that you feel very informed about the information that you've got about the COVID-19 vaccinations. 35% said somewhat informed, 9% a little informed, 7% not very informed, and 4% have said completely uninformed. So as I said, we will ask those questions again at the end of this session. So thank you all for participating in our two polls. I'm going to pass you back now to Lizzie, who's going to introduce our first guest.
Thank you, Melissa. Thanks everyone for taking part. So yeah, I am very honoured to introduce our first expert today. So I'm Natasha Leslie. She is the Home Manager of Heavers Court. Natasha has spent over 2 decades working as a domiciliary care manager and in the public sector, recruiting nurses, social workers and support staff for social care settings. Natasha came to Care UK as a specialist training manager for end of life, then moved to become the Home Manager of Heavers Court. Over the last 6 years, she has grown her team to be as passionate as her about the care and treatment they provide to the residents. Natasha, would you be happy to just speak for 5 minutes about your COVID-19 experience and your decision to take or not take a COVID-19 vaccine?
So thank you, everybody. Thanks for having me, obviously, BME Forum. I feel quite privileged. My experience, obviously working in a care home, it's kind of like the done thing that you have to have the vaccination. But I just felt very nervous about it because you kind of want to put something into my body that could possibly harm me or take me away from my family. I didn't have enough information or research out there. You know, one of the things that worried me was the Pfizer vaccine, obviously the temperature control of that. And obviously I've suffered from a lot of allergies as well. So there was lots of different things. Everything was going around. And also as well, one of the main issues was social media. At one point, people were just sending stuff. It was just constant, you know, just being bombarded with negative and also positive information on the COVID vaccine. So I kind of decided to do the research myself. You know, I had to go out there and find the information. There was lots of information from Care UK. There's information from the NHS, Croydon as well. We have lots of provider meetings, lots of information out there for me to go and do my own research to make up my own mind. I think I finally made my mind up when we didn't have COVID in our home at all until around October is when we got COVID in the home, and it was detrimental, you know, and it wasn't so much to the residents who passed away. Most of them passed away in hospital, not in the home, and picked up COVID in the hospital. It was the staff, you know, to see them walking around. They were walking around like zombies. You know, there was times when they'd finished their isolation period and they'd come into work and they looked awful, you know, and they physically could not do their jobs and had to be sent home. It was just really horrible to see. And then the flip side, even though I didn't have many deaths in the care home, it was more my family impacted, till I actually just stopped counting the numbers, you know. I just felt that I couldn't do my traditional funerals, we couldn't do our wakes. It just feels like I haven't laid those people to rest for me personally, you know. So as I said, I did my research, and then I decided that I was going to have the vaccine. I remember the night before, I hadn't told my husband, so I thought I need to let him know that I'm going to have that vaccine. So I went in and I said to him, you know, Daddy, I think I'm going to have this vaccine. And he said to me, you know what, Mummy, I'm thinking about it too. And that kind of like was the green light for me, you know. On the day, our home served by Dr. Sharmit Roy of Bridgestone Medical Practice. He let me feel really, really at ease. He gave me more information on the vaccine. You know, people kind of said, you know, what it contains, dead babies, all kind of things. As I said, that was going around. It was just horrible to hear, you know, but he gave a lot of reassurance. It was himself and also a nurse that comes in here, one of our district nurses, Charmaine. They did all of the residents in here, and then all of the staff. I was one of the first members of staff to actually have the vaccine, because I just thought, you know what, I'm the manager. I need to show presidents and let them know, you know, I'm having it done. Don't be scared. You know, as I said, I had the vaccine, and I will say there was side effects. I didn't get mine straight away. I got very, very delayed, maybe 3 or 4 days later. I had a little bit of a headache, my arm ached, but that was really it, you know. But I'm actually glad that I've had it, because I feel that I can protect myself. I don't want to be one of the people that are in hospital, you know, in intensive care, saying that I wish I knew. So I just say to everybody else, do your own research, you know. And again, within the social care industry, it's kind of like everyone has to do it. But I think everyone needs to make up their own minds rather than be forced to take this vaccine. Do your own research and be comfortable with it yourself, rather than just go and have a vaccine.
Thank you, Natasha. Thank you very much. I'm Sarah from Croydon Voluntary Action, and we'll be moving on to the next speaker. Unfortunately, we've got apology from Rachel Flowers, but we're delighted to introduce our colleague, Dr. Jack Bitman. So Dr. Jack Bitman is a consultant in public health, and he has been working as a consultant in Croydon since 2016. He did his medical training in Southampton and qualified in 2007. He worked as a house officer across hospitals in Hampshire and London and in New Zealand before specialising in public health, where he undertook his training in Wandsworth, Brighton and Croydon local authorities. He also worked in Public Health England at a national and London level, South London Health Protection Team and Department of Health and UCL. So we've asked Dr. Jack to talk for 10 minutes to give us any updates about the COVID-19 vaccine rollout. So if you want to give us this update, Dr. Jack, we would be delighted.
Oh, thank you very much, Sarah. So yeah, in terms of the vaccine and the rollout, I think a lot of you, you know, a lot of people have seen in terms of the press the fantastic work that's been done in terms of the rollout. In fact, you know, the speed at which it's being rolled out, and Natasha's just given us a great example of the kind of actually the journey that people go on in terms of kind of, you know, vaccine decisions, but also talking about the care homes and in particular kind of the work and speed that's happened in terms of the vaccine rollout within the care homes. And so I'm here talking from a public health point of view, but we can't take credit for that because it's really been the work of the NHS colleagues kind of putting that together, and also a lot of assistance across communities, community groups. And really, I think it's something that we should be celebrating, you know, across all kind of parts of the community, because it's been fantastic. Having said that, as kind of again, as Natasha has kind of pointed out, within care homes, and this, you know, it's a lot kind of around the press and stuff in terms of the kind of the uptake and the fact that, you know, the majority of residents have it, but actually we've got slightly less uptake in terms of staff. And I think again, like I said, I think Natasha just captured it beautifully in terms of the journey that people are going on in terms of vaccine. And I think it's all very well and good for, you know, for us to just say, like, you know, this vaccine is here and it, you know, you should take it, it works. And some people that works for, and some people are kind of, you know, that's already kind of, you know, they're primed even before you say there's a vaccine, they're going to take it no matter what. Other people aren't in that place, and actually there's a journey to go on. And I think these kind of meetings and all this kind of sharing is really important to make sure that people have the information that they need to be able to make those decisions themselves. So in terms of where we are in terms of the rollout, I think as I think was it Lizzie at the beginning, I can't remember who at the beginning kind of said it, you know, in terms of we are at the stage where we're at anyone over the age of 50 and people with certain conditions who are at higher risk of COVID, as well as people working in adult social care within certain parts of the voluntary services and healthcare services are eligible and be encouraged to have the vaccine. And so the reason for that, I don't know if it's useful just to kind of quickly say, you know, why is it kind of being done in the kind of, you know, staggered rollout that it's being done. I guess just the kind of most basic kind of explanation of that is that it is being rolled out in terms of trying to make sure that we get it to the people who are most likely to end up in hospital, most likely to die of COVID if they were to be infected. And so that has been the overwhelming kind of priority, has been those people making sure that they have the vaccine first and that they have the benefits. And then alongside that, people who would be kind of, you know, caring and kind of alongside them, who are potentially, you know, a risk of bringing it into those communities, into those groups, those alongside. So that's why it's been prioritized the way that it has. And so this is kind of, we're coming down the kind of at risk groups to kind of getting to the lower risk groups, which are in the younger people. Having said that, one of the things that you kind of know is that as we get into the, you know, younger age groups, might be less individual risk, but actually the younger age groups are a significant risk in terms of the kind of, you know, the amount of mobility that we have, in terms of if we do get the virus, obviously we, you know, like then you are someone that can take the virus from one place to another. And actually we see that a large amount of spread, particularly now, is in the younger age groups, coming from younger age groups. And also, although again, you're at kind of, you know, younger age groups are at lower risk, obviously if infection numbers, you know, the more people are infected, even if you're at lower risk, the more people infected, the more likely you are to have some of those ending up in hospital and some of those unfortunately passing away as a result of the virus. So it's still very important that we make sure that we get the coverage, and we get the coverage across all age groups as the vaccine becomes available for different groups. I also just want to say, because, and I know it's already kind of been in the comments, there's obviously lots of questions around AstraZeneca and in terms of kind of the question marks around blood clots and, you know, DVTs and things that's been in the news. And I think from our point of view, you know, there is nothing that we've seen from our point of view to suggest that there's any concerns around that. All the evidence that's been shown so far, and I think this has actually been relatively widely put within the press as well, that the number of cases that are seen, they happen ordinarily on occasion, particularly when you're seeing, you know, when you're dealing with such large numbers of people, you will have the odd person who unfortunately has a blood clot within the normal population. We're talking about 11 million AstraZeneca vaccines that have been done in the UK alone, another 7 million odd that have been done across Europe, and they're only talking about a handful of cases of blood clots. If anything, it looks like the numbers are on the kind of lower side than they kind of would be expected in the number of people that have been vaccinated across these groups, and older age groups are at higher risk of these things. So I think it's just really important just to kind of put that there, that is something. It feels like at the moment we're seeing a lot of kind of politics, vaccine politics going on in Europe, which fundamentally are unhelpful. So I just want to kind of just talk about that briefly. Other thing as well, in terms of vaccine as well, I think, you know, all of us, we're all gagging to get back to normality, aren't we? And I think the vaccine is part of that journey back to normality, but it is not the whole. It is not the whole part of, you know, the whole part of it. So where we need to get to is that we are continuing to do the hands face space. Get it right. We still have to be doing the social distancing, the kind of minimizing, and following on with the kind of opening up as it goes along the kind of national plans, and still following those rules, even if we've had the vaccine. And the reason for that as well is this is all part of the kind of, you know, the numbers thing. It's like some of it is evidence around how much the vaccine, we're still learning how much the vaccine stops transmission of the virus. So it may protect you as an individual. It doesn't mean that you can't have it and pass it on to other people who are vulnerable. But also that's even still, we still got a decent, you know, we've got a large number of people vaccinated. We've still got a very significant number of people who aren't vaccinated. And as I said before, you know, when you play the numbers game with that, that still puts people at risk of serious illness and hospitalization. So it is really important that, you know, that until the message changes, until we start to see that evidence, and actually we've got such a significant level of our population covered, that we are protecting those most at risk by continuing to follow all the advice. So I think that's probably about it for me, unless there's anything missed in the questions or anything.
Thank you, Dr. Jack. My name's Lisa Hungerford, and I'm from Croydon Neighbourhood Care Association. We were waiting for another speaker, but we're going to rejig it, Dr. Agnello, so it will be you next. I'd like to introduce Dr. Agnello and thank him for coming along today. Dr. Agnello Fernandez has been a GP at Parchmore Medical Centre in Thornton Heath for 31 years. He's the lead GP for Croydon Borough South West London CCG. His interests include dermatology and quality improvement of health services through innovation and transformation. He's a GP trainer and a governor at Royal Russell School. Dr. Agnello is also chair of NHS England's Pan-London Integrated Urgent Care Clinical Governance Group and the chair of the National Intercollegiate Clinical Governance Group for NHS Pathways, and previously was the National GP Lead for Urgent and Emergency Care for the Royal College of General Practitioners. He was awarded the MBE for Services to Medicine and Healthcare by Her Majesty the Queen in 2004, Fellowship of the Royal College of General Practitioners in 2006, and his practice attained the highest honour of the Royal College of General Practitioners Quality Practice Mark in 2010. Dr. Agnello, please can you speak about how our community has access to vaccines and the possibility of people jumping queues?
Thank you, Lisa. So as you can see from my background, I'm being really optimistic. It's been a long year, and like most folks in the health and care sector, we haven't really had a holiday, and most people haven't had a holiday in all this time, and we've got to look forward. And you know, there is light at the end of the tunnel, and I think this year is critical that we take all the measures that are available to us to be able to achieve that. So the two topics that have been assigned is about access to vaccines. So the first point to make is, up to now, vaccines have been adequate. In the last couple of weeks, there's probably been a shortage at the front line. But as from the end of this week and for weeks ahead of us, there's going to be plenty of vaccines. So it's not a question of a shortage of vaccines. We're going to have more than adequate numbers of vaccines available. Some sites had to not do any vaccination over the last week because there was a shortage. So the coming weeks, we have a supply issue of a surplus of vaccines everywhere. I think it's just important for us to reflect. It's just been a short period of time. The first vaccine was given in Croydon in the hospital on December the 9th. And since then, we've developed community vaccination sites with GP surgeries and primary care networks, and we've got 6 of those across Croydon. We've got 2 mass vaccination sites, one at Crystal Palace football ground, and the other one opened last week at Central Shopping Centre. And it's been a real pleasure to go and visit every one of these sites and see the enthusiasm of the staff that are setting them up, because it's been no mean feat to be able to do that. And for the GP sites, it's not only running the vaccines, but doing your normal day-to-day work as well. So it's meant a lot of effort by a lot of people to make sure that vaccines are accessible to patients and the public in Croydon. But some huge successes really in terms of where we started and where we are to this day as well. We've got 126 care homes in Croydon, and successfully giving the first dose to over 90% of those residents being offered a vaccine is a huge success, and that was done before the deadline that was set for us. And you know, it is, even though the London average is about 93%, we've done really well given the number of care homes to have achieved what we have done. And also in terms of housebound, being able to have offered our housebound patients the vaccine, which is again, you know, depending on which vaccine you had, took a lot of organising to do, but that was done. So we've achieved a considerable amount already, and the vaccination sites have been, you know, depending on which type of vaccine, 400, 500 vaccines a day. If it's an AstraZeneca, and probably slightly less than that if it was been a Pfizer vaccine they've had. We've not had a choice of which vaccine is going to be delivered, and that's been organised nationally. But you know, it's been a huge success, both in terms of the government or whoever has been organised purchasing the vaccines, all the people involved in transporting the vaccines and organising the deliveries, and the people that have been involved in giving them and setting up the centres to be able to do that. And as Jack has said, the priority has been the vulnerable people to start with, and you know, we've done well to get to the level that we've got to now, to the over 50s and younger age groups with underlying health problems as well. And it's a real success story for this country and in Croydon as well, in keeping with that, in the number of vaccines that have already been offered and actually given to people. And as more evidence comes out, we're seeing that not only does it reduce, even after the first dose, reduce the incidence of serious disease and death, but also of transmission. And it's real hope in terms of going forward and seeing backgrounds like I have behind me in not too distant future. So it's a real sign of hope. And yes, we've got to do all the public health measures, but actually the vaccine has been a game changer. So the next stage is going to be in terms of the cohorts that we're working on now, and then moving on to the second dose. Now, there's always been, there was some controversy about why did the country decide for the second dose to be about 12 weeks. And initially there was a lot of concern about that, but it was the right decision again. And it came left field for even clinicians and the BMA and doctors groups when the trials, certainly for the Pfizer vaccine, suggested 3 weeks, but the government said 12 weeks for both AstraZeneca and for Pfizer. But it was the right decision, and the WHO has also confirmed it was the right decision in terms of being able to give more people the first dose and give more people protection rather than giving less people two doses and giving them not that much more than the first dose in terms of protection. So again, that was the right decision to have been made, and other countries have followed that up. And just to add to what Jack has said, yes, there's a lot of noise at the moment relating to the Oxford AstraZeneca vaccine, but certainly from a clinical point of view, even the European Medicines Agency statement yesterday was quite clear. There is no risks associated with the vaccine, and it is safe to be used. Again, the MHRA in this country came up with the same conclusion, and the WHO came up with the same conclusion. But just to give you an example of how small the world is, I got WhatsApp messages from my family in Goa to say, we're due to have the AstraZeneca vaccine next week. Do you think we should have it? Are we at risk? Should we just wait? And these are questions that people have been asking everywhere. And the answer was quite clear, that all the evidence is it's safe. The incidence of the clots compared to the number of vaccines already given are even less than you would expect in the normal population. So there is it's purely coincidental rather than anything to do with the vaccine. And then giving them the right information to make that decision was helpful. And so they said, yep, we're going to go and have our vaccine that week. So it's important, I think the message there is to have the right information, having trusted information to help people make a decision. We still have, even though we've got access to vaccines now, as I said, hospital, GP, community sites, mass vaccination sites, and increasingly more pharmacies, there are still some patients and members of the public who are hesitant. We're making some progress, and it has been incremental with care home staff, but we still need more to do with care home staff. And there have been concerns about infertility, concerns about long-term effects and everything else. But again, there's no evidence that it affects fertility. There's no evidence that it's contraindicated in pregnancy, and there'll be new guidelines coming out soon, because more and more is being known all the time. And so hopefully that will make people more comfortable in having information to help them decide to have the vaccine. Now, I suppose the other aspect to this is that although the vast majority of people have been having the vaccine, there are still some that are hesitant. And the question about vaccine passports always comes up. And the reality is, whatever your point of view, the rest of the world is going to decide it's going to have one. So unless you want to keep having your holidays, if you can, in this country only, and you don't leave the country, then that's a perfect, reasonable point to take. But if you're going to travel, you're likely to need to be showing some evidence that you've had the vaccines, or two doses. And I think that's another decision making factor for a lot of people. It's not a medical one, but it's a social one. And it's an important one for people to take into consideration as well. So there are still some cohorts that we haven't been making a lot of progress with, and they're the younger adult care home population. As I said, we're in Croydon, we are 10% less than the England average. So the England average is not good in itself. It's about 68%, and Croydon's about 58%. So there's more work to be done. But where we're doing even less well is in terms of domiciliary care providers that are being vaccinated. And the UK average is about 61%, but in Croydon we're about 28%, which requires, I think, a huge amount of work still to be considered that we're doing, that we need to do. And then And this is even before we start getting to the younger age groups, because saying to somebody who is younger, who is fit and well, that you need to take a vaccine to protect yourself against serious disease is one thing, but saying to them, you know, it's better that you should take the vaccine to protect other people, that's quite another thing. I think the Queen herself said that it's about how you protect people around you, your family, your relatives, and your community, and that in itself is a powerful reason for having it. So I think vaccine hesitancy would be would increase as you go down the age groups, but it's important to address why it's recommended the age groups have the vaccine to protect themselves, protect their families, and protect the community. But also another point, the more circulating virus there is, the more likelihood of mutations, and having variants that might be resistant to vaccines in the future is a really important point to take into consideration as well. So it's powerful arguments for actually taking the vaccine, because we know that the current vaccines have an effect on the variants that we have, whether it's South African or Brazilian, but not as strongly as it does with the UK variant. And I'm sure in the discussion we'll come up with some questions relating to that, and we can answer that and give some further information. The second point was about queue jumping. So there's a lot of worry in amongst people, especially carers that haven't been identified before, who are looking after elderly relatives, and although they've not been identified as carers, should be having vaccinations. And so these are people that were thought to be queue jumpers but aren't. And I know the term queue jumping can be quite emotive, but at this moment in time, it's really identifying who those are. And the National Booking Service, as it was on the news yesterday, doesn't quite identify people as being authentic in the groups that are being vaccinated at the moment. And so, you know, I'm not sure it's as big a problem as people think it is. There's also other groups that think themselves as vulnerable, and who may be vulnerable, who haven't been captured by the system, and who feel that they need to be vaccinated in the younger age groups. And there was, before the schools opened, and still now, a lot of fear amongst teachers going to school, and they've not been vaccinated. And of course, policemen as well. They've not been vaccinated either. They've not been in the at-risk group. So there's a lot of people who haven't been identified in the vulnerable groups, who themselves may think that they should have the vaccine because they work in environments where they're put at risk. So would you consider them to be queue jumpers? If they're people that are having those vaccines at the end of the day, rather than wasting the vaccine, you're giving it to people that are not on the list, then that would seem quite legitimate, I think. So to classify them as queue jumpers may not be the right term, but I think it's given that we've had a limited supply up to now, it's not, you know, it's been important to be vaccinated the most vulnerable first. But going forward, as we start going down the age groups, there will be plenty of vaccines. So I think the concept of queue jumping will be less going forward. So I think the main message is there is the vaccine, there is the cohorts that the JVCI, Joint Committee on Vaccine and Immunisations, have set, and it's important that we follow that to make best use of the vaccine that we got to protect as many people and the most vulnerable groups first. And as we start moving into the second dose, the importance of making sure that those vulnerable people get their second dose first, so that people that think they are vulnerable themselves but actually aren't on the list yet don't take up the second dose for the people that do need that. So I'll stop there, and hopefully that's answered the two questions you set me.
Thank you very much, Dr. Agnello. That was very informative. We've had quite a few questions and comments in the chat, so we will go through that with you afterwards. So thank you very much. So next we've got our final guest speaker, who is Dr. Nena Asuji. Dr. Nela, hello.
Hi, hello. Lovely to be here with you guys.
Thank you for being here. So you have 20 years experience in the NHS, and Dr. Nena is currently the medical director at Croydon Health Services and has been in this role since 2015. And prior to this role, she was the associate medical director and deputy medical director. So thank you very much for being here today. Yeah, if you could just provide us with an update on the vaccines, and in particular, some people have concerns about the mixing of vaccines. So thank you very much.
Thank you. And firstly, can I apologize? I was unable to join you earlier, and these sessions have been brilliant. The aim and my particular enjoyment of them, and hopefully yours as well, has been the ability to have conversations with people, to answer questions honestly, to dispel fears, and to hopefully provide information for individuals like yourselves to make decisions. What I'm seeing more and more, and I think it was something that I myself could resonate with, is that people are requiring time. And it takes a little bit of time to assimilate. There's a huge amount of information out there. There's a huge amount of misinformation out there. And so a lot of people have just needed time to think, to absorb, to question, to digest, to correct where that information is incorrect, and to come to their own decision about the risk of COVID, which is a real and present danger, which is a condition for which we are still seeing people passing away far too early, actually, and in wave 2, younger people as well. So we know that there is a present risk with COVID, and then we know that the one element we have to protect us against it is the vaccine, which has proven to be efficacious. So there is that. Then there are other elements, and I just thought many of you would have heard my story already. I am a risk-averse individual. I am a conservative, measured individual, and it took me a little bit of time, because I wanted to see the evidence, because I wanted to understand the evidence, because I wanted to question the evidence. And also because, to be honest, I think that there is something about those people who are of highest risks being first in line to receive the vaccine. And I know Dr. Fernandez was speaking about that. And so from a sort of social justice point of view, it was right that those who needed it most got it first. And that time was good for me, because I did go through the evidence myself. I was able to, both on a medical and a human basis, understand, appreciate, and make a decision around how I protected myself and those around me. And also, I got to see the millions and millions of other people who had had their vaccine without significant side effects. So I know the first shot I had, and just to share again with everyone, I am slightly needle phobic. So that was a step as well, just to have it, was relatively painless. A day or two after, I probably had a little bit of pain on my arm, a couple of headaches, and it was fine. The second one, a little bit more pain, a little bit more by way of headaches, but again, nothing in comparison to what I have seen of people who have come in with COVID. And in the second wave, unlike the first, I keep talking about the degrees of separation. We worked long hours in the first wave, and I would go home and it would feel like a completely different world where nobody truly understood what was happening or the impact of it. In the second wave, I went home and my kids would tell me about their friends who were positive, or their friends' parents, or their friends' grandparents, or somebody knew somebody who had passed away from COVID, who had suffered from COVID, who had to be isolated from COVID. So much more pervasive, much more prevalent, much more real, much more close. And I think that's really important, because it means that the decisions we make are not about something that is a distant risk, but a risk that has been present, really close to where we all operate. And I think there is something about, how we get back to some form of normality, and what does that look like? And part of that preparation would be how we use the vaccine to help stabilize those sorts of decisions. I wanted to say thank you for everyone who has come, not just to one session, but to many other sessions, and just to have that repeated conversation, dialogue, and time. I wanted to say a special thank you about some of the feedback I've heard, because I don't, and I've never believed that this is a one-way conversation. It's been hugely, hugely helpful to understand why people are where they are and what their concerns are. And I hope that if for no other reason than to dispel anxiety, that these conversations continue to be particularly helpful. I am interested at this minute in time, and I know that you're all young, but I'm also interested in that the cohorts that are yet to come, I would like to understand where they currently stand in their thinking around the vaccine, because we will be moving down the cohorts and getting to younger and younger people. So there's a bit of work around gathering insights in a very quick survey. So if this is something that you've seen, it'd be really helpful if you can share it as far and as wide as possible. And Lizzie, I'm happy to share the link to that so that we can make sure that we use every opportunity to hear from everyone and from voices that don't come to conventional fora. I want to hear from everyone, and I want to understand the insights and opinions of people who are younger in age than I am. I think I can't stand before you and not mention that the anxiety around the AstraZeneca vaccine right now. And I wish I had a pure answer for you, and I'll put my hand up and say, I don't have a pure answer for you. I have a number of points that I can make. And one would be the fact that these are vaccines that have gone through rigorous trials, and they've looked at the data before they were released. I would also share the fact that there have been at least 17 million doses of the vaccine given out and 40 instances of clots. And if you were to look at 17 million normal people, you will find more than 40 clots in the general population. So there's a disproportion there. I would share the fact that COVID itself can cause clots, and those clots can be fatal. So there are a number of things in that realm. I know that the regulatory authorities will be pronouncing, because they've taken all the data and they're digesting it, and they're going to affirm tomorrow on this particular area. What I would say to everyone is that if for any reason you are hesitant because of that, and you're not sure that you want to go straight for your booked slot, please don't waste the slot. If you can let the team know that you want to defer it, that would be helpful, because there are people who need it and who want it, and we don't want to waste those slots. But certainly the volume of clots that are being seen compared to the number of vaccines given is much lower than the sort of natural prevalence of clots in the population. And also recognizing that clots are a significant risk from COVID itself. So there is a balance to be looked at in that context. And that's the information I have to date. There will be more information coming every 24 hours. And as we get that, we will share that with you. I know as well that from a national point of view that they have looked at it and they haven't discontinued the program, and that there are a handful of countries who have done so. And you know, in retrospect, people will look and say that might have been premature, but I think it is very important that we affirm and convince and support people at this particular time. And I'm happy to take any specific questions.
Amazing. Thank you, Dr. Nina. Well, you know I'm a massive fan of you anyway. You always give the honest answers, which I think is what we really appreciate. So we are, as you say, interested in what you guys have to say. So this is your opportunity now. We're going to open up the forum to the public Q&A, basically. So the way we normally run it is, if you've put something in the chat, then basically myself, Melissa, Lisa or Sarah may very well ask you, are you comfortable for us to unmute you? And because we prefer for you to be able to ask your own question. If you're not comfortable, then we will read your question from the chat for you anyway. So if you are comfortable, Philip, you were right in on the start and you asked your question first in the chat. If you're comfortable to unmute yourself, then please feel free to ask your question to our experts. And if you're not, then I will ask the question for you. I'll give you 10 seconds to unmute in case you want to. Okay, cool. So Philip was asking that he's had his first jab back in February, and his second one is due on the 30th of April. His first one was at the St. Paul's Church, And then his second one is now going to be at the Crystal Palace football ground. Initially, for his first jab, he had the AstraZeneca. His question is, will he have the same AstraZeneca again? Do you want to go with that, Nena? Because I can see you shaking your head or nodding your head.
Yeah, I am. So there are two reasons for it. Obviously, the trial information was based on having 2 doses of the same vaccine. So that is the loyalty we are applying in terms of our vaccination. And the second is around planning. So in terms of the number of vaccines that are supplied, if you've had Pfizer first, we actually automatically book for you to have Pfizer at the second dose. And that allows us to have a supply and demand balance in terms of who's having what. So the efficacy and the trial data goes with the same vaccine, and the supply commitments require us to do that booking. So you should expect to have the same vaccine, yes.
Brilliant. Thank you, Dr. Nella. Go ahead, Dr. Agnello.
Yeah, so that's the plan. There are some trials already going ahead to look and see whether you can mix and match, and so we don't know when that will report, probably in the next few months. But at this stage, whichever first vaccine you had, then you should have the same one as the second dose.
Brilliant, thank you. I'm just going to pass over to Melissa, who's going to give you guys your next question.
Thank you very much. So the next question came from Jay Patel. Jay, if you're still there, would you like to ask the question? It is around the AstraZeneca, and I think Dr. Nena might have answered part of the question for you. But Jay, if you're there, would you like to ask the question?
Yeah, can everybody hear me?
Yes, we can.
Okay. Now, I'm quite happy. I think Dr. Fernandez and Nena both addressed that it will be the same vaccination. That's fine, because I'm due for my second vaccination. I have listened to a lot of press recently in terms of AstraZeneca, and I think I totally vouch for the research that has been carried out. I totally vouch for the information coming out of the NHS. It does, however, put a doubt in your mind. If you had the first jab, it does affect you personally anyway. That I'm reading all this, and there is something coming out as in blood clot. So thanks for addressing and putting my mind at rest. And I will try and see that if somebody has had AstraZeneca jab as a first jab and are due for the second one, it's what information I can give them in order to convince them that it is still okay to have the second one. I am worried about the young age group, because if the young age group is now identified as someone that vulnerable to transmission, yes, I want to see if we can try and contribute our support in that manner in the terms of collection of the data. So now whatever information you have, I'll be very grateful to look at it and try and come back to it. And this is for Dr. Bitman. I have recently, in fact, yesterday, supported one of my clients who is going to be planning for the opening of the business in Croydon, and it's a pub, but he's desperate in terms of opening the pub. And one of the information that I've asked him on contact tracing is to also make sure that they collect either that they've had vaccination or not, and the number of vaccinations they've had. And if that information is useful to collect, I think there should be a guideline for the government guideline in the opening of the restrictions to say that that information would be valuable to the NHS for the research they want to carry out in terms of following up the effect of people who have been vaccinated on people who have not been vaccinated.
So my understanding is in terms of when people are being COVID positive, you know, people who are getting positive tests back, that actually there is work already kind of undergoing to understand whether people who have had vaccine, whether the people have had vaccine and kind of any time frame, so to understand if there is you know, any kind of issues around that. That's kind of started from the very beginning of the rollout to understand. So at a national level, that's already happening, and that would happen kind of through the kind of NHS test and trace, or also just through the kind of clinical kind of data groups groups as part of the kind of general kind of, as Agnello mentioned earlier, around kind of trials that are happening. There are lots and lots of trials going on in different parts of the system to try and make sure that actually we understand, because there's one thing understanding how the vaccines work in a small trial, then when you put it in the population, different things can happen because you're dealing with such large numbers. So again, there's lots of different trials that happen to try and capture that information. So I think that is happening and kind of being fed into the system through other routes already.
Thank you. Thanks.
Okay, I think our next question is from Dr. Liz Okokon. Dr. Liz, would you like to ask your own question? Would you like to be unmuted?
Yeah, hi. What my hair looks like, so not so about the camera. But just at my family, in the second wave, we went through my sister who's working and we went to protect her physically.
Sorry, we can't hear.
Can you hear me? Oh, I've got the sister over here. Yeah, so my sister's a head teacher, and she's usually the carer for my 89-year-old mum. Okay, 89-year-old mum. But she's been working in school since day one because she's worked in school with lots of vulnerable children. So she really hasn't been able to come and feed my mum or nurse my mum or anything. Mum has a day carer, and my middle sister moved down from North London where my mum tested positive just before Christmas and moved in with my mum. My middle sister is actually more vulnerable than my mum because of high blood pressure, diabetic trait that my mum doesn't have, and another comorbidity. And we found it really hard to get my sister the same care that if my mum was a white elderly person in a care home. And I raised the point that my sister asked, actually, the point in the chat, because the problems we've had are that as a Black Caribbean, African Caribbean family, we know English, we know the potentially positivity of vaccination, but we're seeing us being treated less favourably than our white colleagues in our white communities. As we know, we look after our families more in the community. And if your mum's positive with COVID and is extremely unwell, how do you care for her without PPE? So we were really struggling to get PPE for my mum and to protect my sister and to protect the carer, actually, because the carer did come in to help with, laundry and stuff like that. But both councils, because we live across the boundary, both councils said they had community PPE. They didn't have it. And then when the vaccine was offered to my mum, she's 89 and she's got 4 invitations. And each time we said, well, my mum's going to have to go with my sister who's her carer, they said the sister couldn't get the vaccine because she was an unofficial carer. I'm glad to see that that the JCVI has now moved on to say, and unpaid carers. But that was something that they put in their very first paper. And I think the government and the health service have misinterpreted the JCVI priority list. And I think that us as Black communities, Black and brown communities, have been, we've been led a dance, actually. They blame the victim, and then they turn around and say that we don't want the vaccine. You can't come to a party without an invitation. But one of your colleagues in the chat has said that she turned up for a vaccine and she felt like she was jumping the queue, but the people that also turned up from her school weren't even invited, but they also got the vaccine. So this sort of idea that we're queue jumping is very destructive, because I've heard on things like on Radio 4 where people are being blamed for not taking the vaccine. If we're such a priority, why weren't we not given the vaccine? And I'm, sitting on the fence because I feel that it is our right as workers to say no to things that we're not sure about. And I feel that some trusts and some private providers are going to say no jabs, no jobs. And we've already seen that in Unite, a rep to Unite the Union, And we're already seeing that in the healthcare workers literally being bullied into taking a vaccine. If you were Jehovah's Witness, you wouldn't be forced to take a blood transfusion. And again, I think it's part of the disproportionality. The care, but the actual community care is my concern, because even now, Mum's only had the first vaccine, and the doctor came and gave it to her at home, which we were hoping for. But you know, we're still vulnerable, and where do we get the PPE? You know, we shouldn't have to be a burden or have to go into hospital when we don't need to, because it feels like the second wave. Everyone who went into hospital died, and I feel that's really tragic. So I think we should care for each other as much as we can in the community.
I think there is availability, I think, of PPE for carers, isn't there? Of I think, would you like to answer, Dr. Agnello?
Jack may be able to answer the PPE a bit from the local authority, but there's a number of things you had you mentioned there. I think not everybody that went into hospital died, so that's a really important thing to get across. You know, hospitals are safe and they actually do a lot of good, and people do come out and they survive. So the vast majority of people are come out of hospitals are fine. The point to make is I agree with you about the unpaid carers, you know, and it's been an iterative process, and everybody's been learning, and the JVCI also learned from that. And you know, how can you know, everybody at the front line is asking the question, how can you vaccinate the elderly resident but not the carer? And so some of the care homes, learning disability care homes, you actually did both at the same time because you were visiting them, and care homes you did both as well. But then when it came to housebound patients, unless they were an official carer and they weren't, you know, they were unpaid, they didn't show up and you couldn't give it. So I think people were just following the rules, but the rules changed as more became evident, and it's important that they listened and that they changed. And yes, it was an issue. It was an issue before. The other bit about the vaccine hesitancy bit, it's impossible to know why some younger people were having vaccines earlier and why some others weren't. So, you know, you don't, just by looking at somebody, you don't know what their underlying health conditions might be. They may have underlying health conditions. They may have ended up in hospital for a serious condition before, but are okay now. But they still appear on the list. Therefore, they're not actually queue jumping. They're appropriate to be having it. The other is that, you know, you could have teachers that attend, or a policeman, or whoever really, but you don't know if they've had underlying health conditions and that's why they've appeared, or if they've been called towards the end of a vaccination session when there's vaccine supply that would otherwise be poured into the sink or thrown out. And so rather than wasting it, I know GPs sites have been investigated for why they didn't throw the vaccine out. And it was morally wrong to throw the vaccine out if you could give it to somebody. And so I know certainly from our experience, you know, there are other groups from practices, obviously health and care workers were first, and then community workers, undertakers, people in the front line, you know, from bus drivers to people working with the public, were called to, if they wanted to have any spare vaccine, so that you didn't waste the vaccine. So that's a different issue altogether. So I think there's nobody on this call who would say that vaccination centres should pour the vaccine down the sink if they've got anything left at the end of the day. I think everybody would say actually give it to somebody rather than throwing it out. I'll let Nena pick up the bit about the hospital. But the other point to make is that yes, there has been increased numbers of people of Black and Asian origin that have been adversely affected, but it's a two-sided argument. If the JVCI said everybody that's Black and brown was a priority, and I was totally against that, because then the notion of being experimented on would actually be fueled even further. You know, black and brown people are always at the back of the queue. Why do you want to be at the front of the queue this time? You know, that would have been totally counterproductive. And so I'm glad they didn't. I know there was a lot of noise from the doctors and the BMA and medical groups to say they should be at the priority list. But actually, if you look at it the other way around, we would have had more hesitancy. And I would be one of those as well, to say, why am I suddenly front of the queue? And so it's important to, you know, there's always two sides to every argument. And sometimes you've got to strike a balance in terms of why things are they are. But it's important also to learn. And there's been a lot of learning as we've gone along. But it's been such a short time frame. So learning had to happen very quickly. So I'll let Nana talk about the hospital.
Thank you, Agnello. I think that you've made some really important points just to re-emphasize. One is that just to remind everyone that 2 years ago, who would have thought we would be where we are now? So this was completely new and people had to learn and adapt really quite quickly. That means that not everything would have been perfect. And we had to therefore keep iterating and changing. And it is because of conversations like this and feedback that the sort of spirit of the law and letter of the law conversation around carers was modified. So this is important. And I'm never going to stand up here and say we know everything, we've got everything correct. But I will say to you, we will certainly try. And a lot of our efforts would be about defending need. And I always make the difference between need and demand. People can put their hands up and make more noise, and the person who's sitting quietly in the back is the one who actually requires more attention. And I would always want us to look at need. And just listening to some of what you said, and there was a lot in there, I would always go back to who is at the highest risk. And the highest risk in terms of, we use the word hazard ratios, are elderly people. Highest risk, 5, 6, 7 times more likely to die if they get COVID. And so even if you have a younger person, there is still a disproportionate risk based on age, which was why when they came out with the cohorts, they started with age as one of the key elements. I absolutely agree with Agnello. If anything else had been done, one, it was not necessarily evidence-based, but two, it would have fueled a whole different conspiracy theory potentially as well. So I think I would go back to need, and I would say your mom's age put her in a particularly fragile and high risk category. I think that the issue of privacy is hugely important. Again, there's some beautiful sunflower lanyards that people wear. I have a hidden disability. You don't know the shoes that someone is walking in just because they're walking tall. So I always reserve judgment on what I see. And then there's the whole sort of moral obligation to not waste a resource that can help save a life, which is really important as well. And I think none of us would disagree with that. That pragmatism has been really important moving forward. And lastly, there is no blame. So this whole concept about people being vaccine hesitant as though it's something that is blameworthy is not something that we subscribe to. The very nature of the conversations we're having, this webinar, other webinars, is not about blame. It's about understanding why people may have legitimate anxieties around something that's new and for which there is so much information. Trying to sort the wheat from the chaff is actually quite difficult. This is not a blame game. And at this minute in time, there is no obligation on you having the vaccine with respect to work. I can understand, and I don't have an answer for what may happen in the future, but certainly the conversations that I've been in have very much been around the personal right to choose, and that's part of that personal right to choose, therefore not making it obligatory for anything else that happens. I'm really interested to see what happens in this space with respect to travel. And I don't know what will happen, but I'm sure those sorts of conversations will probably be some of the next steps. To finish off with, can I just assure everyone that I would normally be standing up here saying hospital is a place that you go to only if you need to. I stand by that. However, people with COVID who came to hospital did not come and die en masse. We saved many more people than passed away. And I really send condolences to everyone we lost. and our staff fought valiantly for a lot of our patients, and we managed to rescue, to salvage, to save, to support a huge number of patients, over 2,000 patients who came through our doors. So please don't ever think that you came to hospital with COVID and it was a death sentence. It's so far from the truth. And we will continue to be your local hospital, providing local services with high caliber staff who are dedicated to your needs.
Thank you. Thank you, Doctor. I've got a question from Alex, which is about the new variant. Don't know, Alex, if you want to ask it yourself, or would you rather have me reading it? No? Okay. So Alex was asking if there is a point in getting the vaccination now, because if there is a new variant, every week people would have to get vaccinated for each variant. So that was his question.
So shall I?
Yeah.
Shall I come in on it? Partly because I haven't spoken for a while, I'll let you rest. Yeah, so obviously there's a lot in the press around new variants and what that means, but so far in terms of the variants that that have been there, we don't have evidence that actually the vaccines that we've got are not working and not effective on those variants. So definitely having the vaccine is still the most important thing. And also in terms of there are conversations around whether there is a chance that they may need they may put in boosters and stuff if we do see that variants actually, or different variants that come along in the future have mean that actually the vaccines potentially become less effective. But this is very much as has already kind of been spoken about. This is this is a field where we're learning as everything as time goes by. We're continuing to learn. But actually, as far as we can see so far, the vaccines that we have are highly effective, and they're still highly effective against the variants that we currently see. And also, I think it's really important to say as well how effective the high level of vaccine effectiveness of these vaccines, as well as that even if you get a variant which actually hits the effectiveness of the vaccine, that doesn't stop the vaccine from being useful. In fact, these vaccines could lose half of their effectiveness and still be incredibly effective, particularly when you get a large enough number of people having the vaccine. And that again is the kind of importance of as many people as possible having the vaccine, because our strength is in numbers, and our strength is in numbers in terms of protecting each other. And that's the importance of vaccine is getting the numbers to have the vaccine, and that's how we protect each other en masse together.
And that follows another question in the chat about, does the vaccine stop transmission? And I think the more evidence there is that it's showing that it does stop transmission, following on to what Jack has said. So there's a real importance in getting vaccinated.
Brilliant, thank you. So I was just going to invite Jean-Paul to basically ask his question, because it was relevant for several people. So I just thought it'd be brilliant if he could ask. So let me just ask you to unmute.
Actually, I'm very much female. I think you said.
Oh, I'm sorry.
It's Jean.
Jean. Okay, sorry.
I have a very lovely looking name on paper. A lot of people do that to me, so I'm used to it. But yes, can I just say, first of all, I'm a resident of Croydon, and I don't even know how I came across this particular invite, but I'm glad that I did, because it's very, very, very informative. And I'm a former nurse. I now work in a field where I help GPs in the primary care market with their software, depending on which clinical system they're using. So I've kind of always been involved in these, NHS field. But my question, or rather a statement, was to Natasha. It was very good that you were able to come and share your journey thus far. But what really struck me was the fact that you said it was a few days later that you had symptoms, because the majority of people that I know, and what's been widely published, is that it kind of happens within, if not the same day, within at least 24 hours. So to know that it's happened to you in a few days later, it's like, right. So the more knowledge and more information we get, it's very good. I wouldn't have known that. I would have just gone with the thing that, if it didn't happen to me in the first 24 hours, I'm okay.
Yeah.
So, yeah. So I don't know if it's more of a question or a statement, but it was a very good observation.
I will say for me, maybe it's my mindset. I don't know. So because I knew I was having the vaccine, I know what I've got to face for the weekend, whether it's washing, tidying up. I did it all on Friday. So I did it all the Thursday. And then Friday when I came in, I did what I needed to do. You know, obviously in our culture, season the meat. I did everything I needed to do. And then I woke up on Saturday and I thought, where's this dead arm? There's no dead arm. And I just carried on. I just got on with what I needed to do. And it wasn't until maybe the Monday or the Tuesday, and I started getting a little bit heady, and then my arm hurt. But I think because I'm just carrying on working, I think maybe because I'm just keep going. Because obviously throughout the whole experience of COVID, I probably haven't had, maybe I've had like maybe 5 days off since last March, and that's it. So it's just, I'm on autopilot maybe. And I think for my staff as well, it was kind of like the same experience. So some of them, the same day, you know, they felt unwell, and then we had paracetamol and Lucozade on tap in this home, you know, and that's what we did, you know. So as I said, if I did feel a little bit unwell on the 4th day, then I took 2 paracetamol, I had some Lucozade, and I was fine, you know. And as I said, it was a mindset for me to know that I've had this. I'm not going to make it beat me and feel unwell because I've taken the choice to take this vaccine now. But yeah, I felt okay, you know. But as I said, others may suffer. And I will say for my residents as well, even my residents that have had COVID, they've recovered. The ones that have been here, they've recovered. We've looked after them well. And then when they had their COVID vaccine, the same thing, paracetamol, Lucozade. That's what we did here. And we got through.
Thank you for your answer, Natasha. Thank you very much. So we're just going to go, and we've got a hand in the audience. We're just going to go to Mukesh. I've seen your hand. Thank you very much for patiently waiting. Do you want to ask our panel your question?
Hello, everybody. Good afternoon. Can you hear me?
Yeah.
Good. What I would like to say that, can we have more, or is it possible to have more open days, open surgery where people could walk in and have their vaccination? You might find more people coming through, because a lot of people are finding it difficult in making appointments through their GP and on the national helpline. I mean, you have 2 going this week, one at the Islamic Center and one at Pontano Clinic. Could you have more? Would that help?
So the Islamic Center one, the timing is at the same time as prayers.
Yes.
So that's to allow people that would, and the imams have been promoting that as well. So they tried that at Stretton Mosque last Saturday, and they're doing that this Saturday. So I think we've got to see how that works, because it's a specific audience. But if you had anybody, and it's open to anybody, but the likelihood is it's mainly likely to be the worshippers that will be going there. But if you have open surgeries, then the point about people that are queue jumping as well, or whether they're appropriate. So if you have a huge queue of people that you didn't expect, and then you're starting to do the second vaccines, are going to be the elderly, vulnerable, that queue is going to be even longer. So there's a risk that if you just had an open system, the people that you want to make sure you have that need to have it won't have it. But specific groups like in the Islamic centers and the mosques, then I think that's fine. The other is we got pop-up clinics going to be starting with the homeless and the vulnerable, and around food banks and the hostels as well. So it's again those specific groups, which are not huge numbers, actually can be managed that way. So yeah, I take the point about the booking, but I don't think it's been a major issue in terms of booking so far. And even the national booking site is easy to get through or speak to on 119. So it's not been a big issue that people have said they couldn't book to get the appointment. But I take your point in terms of would it make it easier for people to do it. But there's some logistical difficulties, especially if we're starting to move on to the second doses. As we said before, the vulnerable have to take priority over this. And if you had one queue with all the vulnerable people plus loads of other people, it would defeat the object of what we're trying to do.
Thanks, Dr. Fernandez.
Thank you, Dr. Agnello. I've got a hand up here from Martin Stevens. Martin, would you like to ask your question?
Yes, hi there. I posted my question in as well. It was in relation to, good afternoon, everyone. It was in relation to what is circulating regarding people that take the vaccine. And there are reports that go around saying that some people haven't made it, as in it didn't prevent them from dying. So my question is this linked to the fact that the vaccine is not a one-size-fits-all type of remedy, in the sense that if some people are from certain backgrounds, or if some people have certain conditions or dietary requirements, it affects some people more than others? Or is it indeed the different types of vaccines for different types of people? As in, is the Pfizer for one sort of person, and is the other vaccine for another group of people or another age group? Is there any light that you can shed on that for me?
Martin, I don't think that's a simple question, but we're here to take difficult questions as well, and so thank you for asking it. I think I had a slightly different version of a similarly themed question around what's the difference between the cell structure of people from different ethnic groups, and the answer is largely there is none. We base all our decisions on human physiology, and we all share human physiology. The second point of the question is, what difference does it make in terms of diet and health? Well, it does make a difference in terms of your immune system and how well you are positioned, both to fight any infection, but also to respond to a vaccine. So if your immune system is weakened in any way, for example, you may not have as marked a response to a vaccine, or you may not be able to fight an infection as robustly as somebody else can. The trials that were done around the vaccines were done on a wide range of people. I think it's fair to say the BME representation in those trials was not high, but it was not non-existent. And there's a separate conversation which I'd like to have through these sorts of venues around how we better represent the BME population in research trials, so that we don't end up asking questions like this after the trials have been done. But in terms of the original, the sort of fundamental aspect of your question, the vaccine takes effect a few weeks after you've had your full vaccine dose. And so people who have died soon after the vaccine are not likely to have necessarily gotten that full protection, if that is the question. And similarly, you could have had or been incubating an infection from which you succumbed, and it just so happened that you had your vaccine at that particular point. What we haven't seen is anybody who succumbed because of the vaccine, which I think might also be a subtext to that question. So the long and short, and sorry, there was one other element to your question, which is, are there some vaccines that are better for some people than for others? At this point, I don't think we can answer that confidently. With the flu vaccine, for example, we knew that we would titrate or calibrate different types of the vaccine to different age groups, for example. We don't know enough yet around the vaccines to say that there's any basis for us doing that. And for the moment, the way the vaccines have been produced and tested, it is for all people with human physiology, and it has been shown to be safe and effective for all people with human physiology. As a rule, whatever we can do to keep ourselves safe and healthy in terms of our diets, our exercise, and strengthening our immune system is something that we should all be doing. I hope that answers the questions you were asking. Let me know if I've missed anything.
Thank you, Dr. Nana. I think that was a very comprehensive answer, actually, to a tricky
Yes, for the most part, it does, and it was very comprehensive. Thank you very much for that. When you said it works for every physiology as well, does that include those who have asthma and other conditions like respiratory conditions?
Thank you very much. I'm going to take a question from the chat. Again, it's from Alex, and it's with regards to clots. Alex, would you like to read it yourself, or? Yeah, okay, I'll read it out. So he says, I've got a clot already. even if it's only 1%, would it not be dangerous to take something that can give me a clot or potentially affect my clot?
Wow. Okay. So firstly, if you've had a clot already, you may want to have a conversation with a specialist and get some individual advice, which I can't obviously share with you on a platform like this. But I can absolutely hear and understand your anxiety in that context. Again, there is more information that will come on this, and I think that would be more definitive and helpful. And we're expecting a pronunciation tomorrow, so watch this space. But I do want to remind people, and this is something that we have observed, that you can get clots from COVID and that those clots can be fatal. That at the minute, from the data we have to hand, of the 17 million people who've had the AstraZeneca vaccine, 40 have developed clots. And if you were to look at 17 million people in the general population and look at the incidence of clots, it would be higher than that. So at the minute, in terms of the relative risk, what we're seeing does not seem to be disproportionate. But I would really, really strongly suggest that you have some individual conversations with a specialist clinician to allay any fears you have, and that we all watch this space for what will be pronounced tomorrow. But at the minute, our program in the UK continues.
Yeah. Just to add, in the vaccination clinic, we do have people that have had DVTs or clots in the past, but that's, at this moment in time, it's not a contraindication to having the vaccine. Some people have had clots in the lungs as well, in terms of pulmonary emboli, and that's not a contraindication either. And the having COVID itself is a much more riskier in terms of developing clots, because it's a condition that increases the risk of clots. So in the round and in the balance, then the vaccine is safer than getting COVID itself in relation to clots.
Thank you both doctors for answering. Teresa, I can see you've got your hand up. Are you happy to unmute yourself and ask your question?
Oh, thank you very much. Hi everyone. My name is Teresa. I have how you call it, the remain to stay. I have a status. I'm Spanish, but I wanted to raise my hand today, just representing maybe not so many Europeans that are in Croydon, but maybe some of us. First, let me share, just for you to understand, when all the Brexit started, I saw a lot of friends leaving, going back to Europe, but I have a very strong connections here. I'm from North Spain, so I have also ancestors in this land, let me say. And I decided to stay, and then the lockdown started, so I also saw some good friends going back to Spain because the restrictions on traveling. And now I'm facing this challenge where my family is told not to have the AstraZeneca back in Spain. They said it's not safe, and now my GP is telling me to have it. So I don't know if that maybe you can relate a bit to what I'm saying. I don't know, but so at work, I've been working all this time. I had a full time. I pay all my taxes. I am very happy here. I wish I could stay as long as possible, but my manager is telling me, oh, I wish you could see your family soon. So I really encourage you to take the vaccine. But I'm not sure if, so my question is, do you have any information regarding traveling? Because if the continent is not approving this vaccine, even if I take it, maybe they won't allow me to go to Spain. Do you have any information on this? Thank you.
Hola Teresa, ¿cómo estás? Espero que está bien. Bienvenido a Inglaterra. Está bien para tenerte. For the record, thank you very much for asking the question. I think it's important to distinguish the concerns that are being raised. It's not that anyone is questioning the efficacy of the vaccine. There's a question being raised about the side effects. So that shouldn't be something that precludes the conversation you're having about travel. So that's one. And then two, I think it's really important. Thank you for sharing this, because your situation, I think, probably reflects the situation many people find themselves in, which is where they may have a particular way of thinking, but their family thinks something differently. And so we're hoping that these sorts of conversations help to give you the information you can take back to your family and have that broader conversation so that they can make an informed decision based on genuine information that is available. And I do hope that helps. I know Dr. Fernandez had his hand up as well, but I bet he won't answer you in Spanish.
I'll do it in Portuguese. So the definitive answer will be tomorrow. However, you know, I think we're all pretty confident that Spain will restart doing the AstraZeneca vaccine, because it's not in the interest of any of the European countries not to do it. You saw on the news yesterday the statement from the European Medicines Agency, and the report will come out tomorrow. So I think you having your vaccination here is going to be what they're going to be doing in Spain anyway after tomorrow. So I wouldn't worry too much about that. The evidence is quite clear that it's safe and it's effective, and the side effects are negligible and coincidental. The second bit about the travel. Now, this is a really important one. As you know, the European the EU has taken the view that they will be having vaccine passports, and so from that point of view, evidence of having had the vaccine will be it's not likely to be needed. It will be needed. I think got to be realistic about this, so from that point of view, that's something to take into account. Some countries have already said that they will be accepting UK citizens on holiday. Certainly Greece has, if they can demonstrate that they have had 2 doses of a COVID vaccine. If you're trying to book a BA holiday now on the app, and you can demonstrate that you've had your 2 doses, then that vaccine passport is already there if you're booking a BA flight. Other digital platforms will develop quite literally in the next few weeks, I think, and the UK government will make some definitive decisions about that shortly as well. But beyond the UK, the countries are already saying that. I think Jamaica said that. A number of African countries have already said that as well. So and certainly the EU will mandate that, because I think that's what they've already said. So hopefully that answers your question.
Thank you very much. We also have someone else with their hand up. Monfries Dean, are you okay to? Oh, I think Monfries.
Hi, sorry.
Oh, hello. Would you like to ask your question?
Yeah, sure, no problem. Basically, it was just, I may have missed it in the beginning, I'm not sure, but you was talking about the vulnerable groups and talking about those who work in care homes. And I was just wondering if, I know briefly was mentioned about teachers, but whether teachers were going to actually be prioritized anytime soon, or so those in education.
Jack.
Yeah, so at present, there's still no plans around specific prioritization of teachers. Having said that, the kind of the next waves as to kind of how prioritization will be done in the lower age group under 50s. We haven't had as much information, so I don't know whether anything's come trickling down in the NHS world that either of the other two have seen. But I certainly haven't seen any kind of suggestions. So there's always a chance there may be. But having said that, as what's kind of we've kind of said that's been done is that really in terms of they've gone on the evidence of risk in terms of hospitalization and death specifically, and that's been the kind of overriding thing. And actually, teachers in recent kind of publications from ONS and stuff actually have not been shown to be at higher level of risk within the community compared to other staff groups, such as carers, people in the health and care sector. So I wouldn't necessarily expect that they will be like predominantly kind of prioritized along that route. But obviously, I know there is also a lot of pressure politically and from unions, etc., for that to be the case. So I think we'll see, because obviously very important in terms of schools and other aspects.
And those those teachers who've got underlying health conditions would have been called already, or should be called, and they're entitled to get the vaccine. And those that are over 50 obviously would have been already eligible to have the vaccine. So it'll be the very much younger teachers who've got no underlying health conditions that we're talking about here, because the others would be eligible to have it now.
Thank you. There's been a real range of questions answered. There's another question here from Marie. Marie, did you want to ask your question? It's about pregnant women and the vaccine. Okay. The question is, how can there be an assertion that there will not be any negative effects to pregnant women when there not been enough time to verify this?
It's a very topical question, and I think we can all give different answers, but it's probably best for Nena to start with that, because this is something something that is, I can answer it from the care home staff and the community staff, but maybe because this is an issue for nurses in hospital, particularly, especially young nurses who are of reproductive age.
So firstly, just again to acknowledge that it is one of those specific areas where you would understand the anxiety. You're trying to make a decision not just about yourself, but about your unborn child. So I completely understand that. And I know that this is one of the reasons that people have been a little bit less fast about coming forward. Couple of things. One, in some of the original trials, obviously we would not target pregnant women or children in research trials, in initial research trials, but there were a number of women who did give birth soon after, where there was no evidence of harm, and so that did give some assurance. The second point is that the contents of the vaccines have been looked at in the minutest of details to understand whether there's any teratogenicity. That's the word we use to describe where some ingredients can have a harmful effect on unborn children. So none of the constituent products in the vaccine is known to be teratogenic, and that's also been hugely helpful. And the third is that in this group that we're careful. We have to be careful, and the advice at the minute is not a blanket approach to all pregnant women, but it comes back to this sort of risk approach. Who has the highest risk if they get COVID of being severely infected and or possibly dying? Because in that context, the risk of having the vaccine versus not having the vaccine is very different. So in pregnant women, we are recommending, if you have additional risk factors and or at higher risk, that's where we think we should be promoting vaccination to protect you, and by protecting you, to protect your child. And we have no evidence to suggest that it will be harmful to the child. But we're not doing a blanket approach because it is a vulnerable group, in the same way we don't do this for children just yet, even though there's nothing from what we know right now to suggest it would be harmful. And again, this is one of these situations where having a conversation with a specialist is really, really helpful, because if nothing else, your mental health and well-being around that anxiety can be allayed. I hope that's helpful. Agnello, if you wanted to pick up on the care home.
Yeah, so this is a common question, especially with community staff, community care home staff, and even in my own family, it's a question that younger members of the family ask. I think when we first started vaccinating, and it's not that long ago, it's not years ago, it's just a few months ago, the advice was that not to get pregnant if you've had the vaccine for at least 3 months after the vaccine. But that advice is now changed, and there's no contraindication for that. Before, it was unknown, and in terms of breastfeeding and you know, whether to have the vaccine, or after having a baby, whether you have the vaccine. And again, this is again the younger age groups. Unless they had underlying health problems, then you wouldn't be thinking about it anyway, because your cohort hasn't arrived yet. It's not ready yet. And so the question has to be, you know, the risk of catching the virus versus the vaccination. And it's a question it's difficult to give people definitive answers because we don't have all the evidence, but the evidence that there is at the moment is it doesn't cause any problems. And this is a discussion I had with my daughter, who's 29. She said, would I advise her to have the vaccine when her time came and she's trying to get pregnant? And my answer to her was, as a father, was there is no evidence at all that it causes any problem. So she says, would you advise me to have it? I can only give my daughter advice of this kind quite definitively. And I said, perfectly acceptable for you to have it. Okay, so I can do that with my daughter, but I can't do that with a patient. But at the moment, but it gives you an indication, the level of confidence that there hasn't been any adverse effects. And as far as I know, and Jack will correct me, there's never been in the history of vaccines any vaccine that has affected unborn fetuses.
Yeah, not to my knowledge, and I think that's one of the fundamental things. Is there are two things here, isn't there? That one is the evidence that we're seeing from this, and so we are rightly cautious in terms of like when these are new vaccines coming out, and that, as Agnello has kind of described, that initial thing around, we're being hesitant around people who are pregnant or kind of those aspects. Because of the unknown and because this is new, and we become more confident as we see more people of that age having the vaccine. So that is one part of things. But secondly, we do know actually in terms of vaccines and stuff that actually we actively give vaccinations during pregnancy. There are other vaccines, lots of regular vaccine, flu vaccine, other things like that, and you wouldn't not give that vaccine in pregnant women. And that, particularly in terms of the AstraZeneca, which is even more similar to lots of other vaccines that we use, there is nothing in there that would make us fundamentally think that there would be any reason that would have any effect at all on fertility or any parts of your kind of reproductive system. So I think that's why when we talk about it, kind of, Agnello, Nena, and myself, we talk about it with a kind of level of confidence and it's just a kind of case of time with these kind of evidence coming through that kind of just builds on that as well, because they, there are layers of things which kind of give you confidence as to whether something is likely to be affected by something like a vaccine or not. And there's no kind of roots that you would kind of be able to understand that the vaccine would cause an issue like that. And there's no historical kind of evidence to suggest that it would either.
And during the trials, there were several women who subsequently, they had the jab in the trial, but subsequently were found to be pregnant, and they're being monitored, and there's been no real problem with them either. Just as we've said now in terms of level of confidence. But again, you need to have more data to support that. But it's unlikely to be any adverse effects from it.
Thank you very much. I've got a question in the chat from Lee around patients with dementia. I don't know, Lee, if you want to read it out yourself. Okay, so Lee works in a dementia care home and is worried about patients in the hospital that are waiting to be discharged in a care home who is COVID-19 positive. They're still discharging them into the care home knowing they've got dementia and they cannot self-isolate and will obviously move around and potentially pass it on to other residents. And he was asking what can be done about it.
So if I start very early on and ever since, there's been some clear instructions about how we safely discharge people having had COVID, and that includes making sure we have them tested prior to discharge as reasonably possible. The other thing to say is that your test for COVID will be positive for a long time after you might be considered to be able to transmit COVID. So if you've been in hospital for longer than 14 days, the test may be positive, but actually you're still safe for discharge. And I think there's a lot more work we probably need to do to make sure people understand that it is about both the test and the length of time you've been positive, and therefore the safety of you not being contagious. we absolutely adhere to infection prevention and control guidance around how we manage patients both in the hospital and as we discharge them. So that should hopefully not cause any particular concern, but if there's a specific conversation, happy to have one as well.
Yeah, I think this is a really important message to get across. You know, more's known during the second wave than in the first wave, and things could have been done differently in the first wave, but certainly during the second wave, you know, it's not been the case of putting care home staff or other care home residents at more at risk. And then the other point is that if you test positive, even after your isolation period, you can still test positive for up to 3 months. And that doesn't mean to say you're still infectious. It's just that the PCR test is picking it up. So it's important to make sure that the precautions are in place. And in Croydon, I think we've done really well with the care homes, and the care homes are actually much more confident in the support they've had in terms of looking after people that have been discharged back compared to in the first wave. So I think it's a really well done to both the hospital staff and the community staff and the local authority as well.
Brilliant, thank you. So, you know, basically we are at time, but Natasha, because you work in a care home, I didn't know if you wanted to add anything in terms of supporting people with dementia who have tested positive for COVID-19.
I will say it's not easy. It's really, really difficult. For new residents coming, it's most difficult because it's a new environment. They need somewhere to go. You know, they can't go back home, so they're based here. And my home, even though my badge says KUK, my home is a Croydon home. It's a London Borough of Croydon home. So we try to isolate them. Doesn't always work. They come out of their rooms. They go into other people's rooms. It is really, really difficult. And we have had on occasion where we've had a resident go into hospital because maybe they've had a fall or whatever the case is, and they've discharged them back into the home, and they've told us that they've COVID tested them and said it's negative. And then they phoned the following day and said they've got a positive result, you know. So sometimes it does happen. However, we've got PPE in abundance here. I will say we use the PPE portal, and KUK does provide us with all the PPE we need. So we just manage it by infection control practices, but it can be really challenging because my home is a dementia home, and you know, as I said, it's really hard to contain sometimes, but we do try. And on occasion where somebody has come back into the home with COVID and it has spread, COVID, it just lights a fire. Very, very difficult to control. And I will say, unfortunately, one of my carers picked it up and she brought it home to her husband, and he passed away. And this is why I say, like, COVID's really, it is really real. It's real, you know. So when I'm saying to people, you know, get vaccinated, you do need to get vaccinated because it's going to lower your risk. But as I said, in terms of being discharged to the home, I think I'm a little bit more stringent with Croydon. When they ring to say this person's coming back, I make sure that all the precautions, all the boxes have been ticked to make sure that I'm protecting the residents that are existing in the home and also my staff and myself as well.
Thank you, Natasha, and obviously condolences for your staff member who lost her husband. You know, I'm sure everyone here has been affected by COVID in some way, and that, you know, that is why we have these conversations about the vaccine, so that we can make those informed decisions that potentially save lives if we all take it, you know. So fingers crossed. I am the horrible person that has to, you know, put a full stop to things, and I am aware there are more questions, so I do really want to highlight that you know, please do visit the NHS website and get that information for yourself. Take your time to inform yourselves. I think Dr. Nana puts it really well, that, you know, we're not here to convince you, we're here to give you the information so you can make an informed choice. So what we are going to do to finish is at the beginning of this session we had 2 Zoom polls. And so we're just going to do the exact same Zoom polls again, just to see if hopefully some of you have picked up a bit more information and feeling more informed. So I'll pass over to Melissa because she read them last time, so she knows what to do.
Hello, everyone. So yeah, as Lizzie said, we're going to ask the two questions that we asked before earlier. We're just going to ask them again. So as you can see up on your screen, so the first question is, would you be comfortable to take a COVID-19 vaccination booster annually? So the answers are yes, no, and not sure. So we'll just give you a little while longer to answer. I can see some people are responding, so thank you. Yeah, we just want to find out how you're feeling currently, and especially after the information you've received today, how you're feeling. So we'll just give you a few more seconds and then we'll share the results with you. Okay, that's perfect. Can we end the poll and have the results up there? Okay, perfect. So there does seem there's a shift from the question earlier. So at the moment, 57% of you said you would have the booster annually. 17% said no, and 26% said not sure. So thank you for sharing. We will have the second poll question. So if we can just share that on screen, thank you. So the next question is, how informed do you now feel about the COVID-19 vaccination? Do you feel very informed, somewhat informed, a little informed, not very informed, or completely uninformed? Just give you a few more seconds. Thank you for answering. Yep, can we have the results of that poll? Okay, so now the results are 63% of you said you feel very informed, 24% of you somewhat informed, 9% a little informed, 4% not very informed, and none of you feel completely uninformed. So there has been a shift there because a few of you previously said you did feel completely uninformed, and so yeah, more of you feel somewhat informed. So thank you very much for that, for sharing.
Brilliant. Thank you. So yeah, I get the honor of just saying thank you to everyone. So you know, massive appreciation to sort of my fellow hosts. So Melissa from the BME Forum, Lisa from the CNCA, and Sarah from the CVA. Really, it's nice to do it as a team. I really appreciate that. So thank you very, very much. And I do just want to reiterate that if you missed some of this because it's over lunch break, so you might have joined us later, then we will be putting this recording up on the Asian Resource Centre's YouTube channel, and that will of course be shared you know, with the other groups that have also been on here, and will also be shared on our social media as well. So please do keep an eye out and share with your friends if you think there was a question that they've been asking you. And then of course, massive thank you to our experts. We are really always very lucky that we get brilliant experts. So thank you, Natasha, and thank you, Dr. Jack, especially jumping in last minute to cover Rachel, much appreciated. And thank you, Dr. Nena, and thank you, Dr. Agnello. And also thank you for all the work you've been doing for the COVID vaccination work, which I know has just been massive. So we can't appreciate you enough. So thank you, thank you, thank you. And hopefully see you all soon at another event. Bye.
Thank you.
Thank you, everyone. Goodbye.